Good afternoon, welcome, and thank you for joining us for today's HIS Talk webinar, Provider-Led Care Management, Trends and Opportunities in a Growing Market. I'm Lori from HIS Talk, and I'll be moderating. Our presenter today is Matthew Golden. Matt is an analyst with Chilmark Research. With that, I'll turn it over to you, Matt.
Thanks, Lori. Appreciate it. Hello, everyone. Just wanted to thank you for attending today's webinar on Provider-Led Care Management, Trends and Opportunities in a Growing Market. The findings for this webinar are based upon research we had done late last year and early this year in a report that was released on the care management market itself right before HIMSS. And so we'll be going through some of the major findings of that report and a couple of other follow-up activities we've had since that report was published prior to HIMSS, as well as addressing any answers in a brief Q&A session at the very end of the report. Just wanted to go through a quick agenda of today's webinar and a quick rundown of what I'll be discussing over the next hour or so. Brief introduction about who Chilmark Research is and what kind of services we provide to the marketplace, current state of the care management market itself based upon the findings from the study, and subsequent follow-up conversations, vendor landscape, talking about some of the vendors that were profiled and evaluated in the report itself, and then finally a conclusion where we wrap up the findings, the major findings of the report, what we're looking forward moving ahead, along with a brief Q&A section. Chilmark Research was founded in 2007. We're based out of Boston, Massachusetts. Chilmark Research's sole focus is really on transformational health IT. What we provide to the marketplace is really looking at research around cutting-edge delivery areas, whether that's in care management, whether that's in analytics, or several other areas in terms of the marketplace and where health IT really is not only moving towards, but enabling healthcare reform as it comes about. In terms of our domains of expertise, we structure them really within several areas, and have four main ones: analytics, business intelligence, care management, which I'll be speaking about today, clinician network management, which is really health information exchange and focusing on that topic, along with a few others, including consumer-driven health, connected health, and population health management. And then lastly, in terms of the content-driven services that we provide an advisory services for vendors that and other healthcare stakeholders that purchase a membership to healthcare, to Chilmark Research, and subscribe to our research services, as well as providing strategic consulting advice and feedback on adoption and technology trends in the marketplace. I'm going to start with going through a current state of the care management market itself. Again, this is really focused on the provider-led care management side of things and some of the major findings from the report itself. This first slide here really talks about what we see as the vision of the care management future in shifting away from the payer-led focus historically to more of a provider-led focus increasingly. And it really focuses on three areas or three levels of care management. You have the traditional inpatient care management, which is really what hospitals and providers were primarily focused on in the past. This relies almost exclusively upon clinical or EHR data. It's centered around an acute care plan within the confines of the patient as long as they're within the various walls of the hospital. It's geared towards and really focused on the physician or the nurse who are providing care to that individual, and it provides on-premise alerts and on-premise monitoring. Where we're seeing the shift right now is primarily to in-network care management. This incorporates not only clinical data, again primarily from EHR systems, but also claims data increasing and a commingling of the two data types. This features an in-network care plan so that the patient is tracked as they're utilizing various services on an outpatient basis within the network itself. This primary stakeholders from the clinician side are the physician, the care manager, and the patient and caregivers themselves. This also incorporates and relies heavily upon ADT, discharge summaries, and referrals as the patient utilizes different services within the network. And then primarily it's focused upon office visit monitoring and in terms of providing access to the patient and their caregivers through a patient portal. That's where the state of the market is today, and where most of the vendors in this study are really focusing on providing care. Increasingly, though, what we're seeing a shift to is more of a wider community-based care management focus. This not only incorporates clinical and claims data, but it incorporates health risk assessment data, it incorporates socioeconomic data about the patient, it includes prescription information, including refills and compliance, along with several other additional data types. And this is focused more on a community-based care plan, which incorporates hospital and outpatient care, but also additional types of care that may be from a senior living facility or elder living facility where a patient may reside full-time. It may incorporate things in the post-acute environment, or may incorporate other stakeholders in terms of non-governmental services or nonprofit stakeholders who provide care or enable care for this particular individual. Again, this has all the stakeholders both in and out of this particular patient's provider network. The real additional or new data types here that are heavily being focused in this area are social determinants of health and behavioral health determinants that are being added to the community care management. And the two main data types here, two new emerging focuses, are really on remote patient monitoring in terms of not only monitoring the patient within their home, but also on patient-generated health data and patient-reported outcomes. And then primarily a patient relationship management system, which is really an evolving concept in this marketplace, moving away just from the static patient portal concept and broadening this relationship out to really understand and help that provider organization understand really how the patient is interacting across a broader perspective within the provider organization, and how they're interacting with that provider organization outside of the traditional office visit or hospitalization or ER visit. In terms of the evolution of the electronic patient record, this is an important concept that we're seeing starting to emerge within the care management applications themselves. Historically, in terms of what's in an EHR system, it's really a system of record, and it's structured around a series of hosting processes for various data types, primarily, almost exclusively to this point, around clinical data. It's highly structured, it's hierarchical, it's transactional. There's a slow response time to this in terms of changing it or updating it or modifying it. There are long deployment cycles associated with this when a new version or a new solution entirely is installed. And there's also primarily an inward focus. If it's in the physician's office, it's primarily what occurs during the patient's visit to that physician, or if it's in the hospital, really what occurs to that patient while they're within the confines of the hospital itself. Where we see the system, or where we see these solutions migrating towards in the care management solutions that were profiled in the study, was really to a system of engagement. It's about touching people. These solutions tend to be a bit more dynamic and loosely structured. They're a bit more responsive and adaptive, especially as new data comes into these solutions. And as care managers work through the care plans contained within them, they're conversational, they're fundamentally social. And in terms of their deployment, they're short, rapid, iterative releases, and really they're focused about the edge of care. They're really talking about those time periods in between when the patient is actually utilizing a specific form of medical service, primarily an office visit, but also can be, unfortunately, an ER visit, hospitalization, or other type of medical event. In terms of the care management utopia, and this basically is just a very high-level overview of where care management ultimately is driving towards, but is probably several years away from today. It really has three different constructs to it. There is the patient and the care team themselves. This patient that we're using in the example here is an older patient who's a type 2 diabetic and has depression as a comorbidity. This individual has a glucose monitoring app where they can use to report daily glucose testing levels and keep their physician aware of that. They have a Wi-Fi scale to take their weight and keep track of their weight to ensure they're not having complications and wide fluctuations with that. They have a pedometer so that the care team can track the physical activity of this individual to see that they are not having any issues with mobility or other issues that prevent them from doing ADLs, assisted daily living activities, or more broadly, make sure they're getting and getting close to a daily recommended 30 minutes of exercise if possible. And then lastly, there's just this concept of patient-reported outcomes. Not only reporting data or using the three solutions that were mentioned above, but other types of outcomes that are important to monitor with this particular patient, especially in regards to treating their depression. In terms of the data integration and analytics, this really focuses on taking all of this data along with existing data from office visits or other types of particular service-oriented events that are contained in a traditional EHR and integrating them into a patient longitudinal record. And from that data, there can be a couple of purposes or use cases from that. There's real-time risk prediction in terms of when there's a change that the provider needs to be aware of in the status of that, in the health status of that patient. It can be used to determine care gaps to ensure that this diabetic patient is receiving the annual screening visit that they need to see from various providers that are out there. And also, more importantly, it helps to correlate the interventions with outcomes and really starts to track a little bit more granularly what's being done with this patient, the services that are being provided to, and closing some of those things in terms of more process-oriented outcomes. And then lastly, it's really focusing on the clinical domain. There is a level of messaging software and a notification middleware that's in place that basically essentially takes data from this care management application itself and feeds it back into the relevant and necessary EMRs. Primarily the patient's primary care physician, but since this is a diabetic patient, there are often several other types of providers that are providing care for this patient, and it also sends them relevant information as necessary, or makes notification events and sends them limited types of information as necessary. This is where the marketplace is ultimately going to in terms of where we're at. I think we're very early into this marketplace in terms of the applications that are being provided. They're very much on an experimental basis or trial basis right now. Very limited numbers of patients around a particular use case, around a particular disease setting. You're not necessarily seeing polychronic patients being enrolled in these types of programs, and basically a lot of experimentation really reigns in terms of how providers are addressing this, in terms of what conditions they're treating and what types of applications they're using within the patient's health. In terms of the care management market dynamics, I just wanted to spend a little bit of time reviewing what we found in the marketplace based upon our conversation with the vendors and several other relevant stakeholders, including providers themselves. Our estimates are about 30 to 40% of healthcare organizations, again, provider organizations, have made some level of investment in terms of what we're defining as a care management solution. We want to be very clear, though, that the care management marketplace itself remains very fragmented. There's not a single vendor that has leading market share in this marketplace. And even when you talk to provider organizations, they themselves will often define care management in several different ways, in several different nuances, including various applications in that. We have provided both a definition for care management itself, but also more broadly for care coordination and for population health management and the various applications that fit into each of those particular domains. In terms of the vendors themselves, we just talked about most vendors only have a handful of customers and a handful of wins since 2014. This is not surprising. This is a relatively new marketplace in terms of vendors selling into this marketplace. It's a marketplace where a lot of providers right now are experimenting with solutions. If they've had a solution in place, typically with a very basic solution, registry-oriented, compiling lists of patients and working through them, working through those lists of patients, they may be looking for a replacement solution, or they may be looking for a solution to utilize essentially now that they've made some level of analytics and they've hired either a nurse care manager or a nurse care coordinator. That's primarily what these solutions are used or being driving at today. Essentially, it's really a workflow solution or workflow tool to be used by a nurse care manager, whether that's in a embedded model within an outpatient setting, with a centralized model, or a nurse care coordinator, or other basically additional individuals or stakeholders who are outside of the traditional physician relationship that occurs with the patient itself. In terms of the target customer markets that are out there, again, this is primarily from the vendor's perspective in terms of what feedback that they've gotten so far. Everyone's targeting IDNs and ACOs. Again, that shouldn't be too much of a surprise. The real question here, though, is twofold. One, who has actual purchasing power and budgets for these solutions? There's a lot of variation we have found, both within the IDNs themselves and with the ACOs, especially with hospital-led ACOs. What type of contracting vehicles in place, what type of governance structure is in place, and does that particular hospital-led ACO board actually have an annual budget to go out and purchase the solution and then maintain that solution going ahead forward? A lot of questions there remain. One thing that we have seen early on is that we have seen a shift away from the CIO in terms of the most clout in making these purchase decisions to other stakeholders. I'd say the chief medical officer primarily, but there are several other stakeholders who are involved in these decisions, typically sit or have membership on these boards. One other clear trend that we're seeing is a lack of dollars for physician-led ACOs. These organizations typically have access to restrictions to capital and uptake costs with that. They're also very price sensitive. They're essentially looking for a solution that can enable them to enroll in an MSSP ACO type program to close care gaps and to provide a basic level of care, and essentially building off of the initial EMR infrastructure they've installed over the last couple of years. These organizations are, again, very price sensitive by a factor of probably 3 to 4-fold less than the hospital-led ACO market in terms of what they're willing to spend on these solutions on a PM basis moving ahead forward. Payers are also a frequent target, again, which is not a surprise, as payers essentially are moving away from some of the historical payer-led care management solutions that they've purchased in this marketplace from several existing solution vendors, and they're looking for solutions that really can be utilized in some of the new contracting arrangements that they're looking to enroll into. One thing that we have not heard is provider-owned health plans aren't a target yet. If providers are making an investment in these solutions, they're not necessarily making those solely in mind of specifically for a particular health plan offering they have. They're looking to use them for a broader array of patients and patient types. There's a moderate pursuit of single hospitals, CINs, clinically integrated networks, IPAs, PHOs, again, which is not surprising given the reduced purchasing power of these organizations and reduced employment of some of the nurse care managers and nurse care coordinators. And then lastly, several markets are being pursued minimally: post-acute, patient-centered medical homes, employers, and federally qualified health centers. Again, this is primarily just due to either a lack of necessity from these organizations to pursue that, or a lack of funds, or a little bit of both. In terms of the patient-centered medical home, we've typically found that that is part of a larger or existing strategy in the outpatient setting, and that's being incorporated into a broader initiative or organization strategy around their provider-led care management initiatives. In terms of the vendor landscape, again, this is primarily based upon the vendors that we spoke to and were included in profile report, along with a number of other vendors that we're tracking in the marketplace today. Just want to give a very high-level overview and then move into a couple of specifics. In terms of the vendor landscape itself, it's extremely messy. There is just a very large number of vendors in this marketplace right now. For this report itself, we evaluated over 80 vendors. We profiled over 22 vendors that were well established at length and graded them. In the report itself, there were shorter profiles on 10 other startup or emerging vendors that we thought were of note or worth noting in the report itself, and continuing to track and talk to almost new vendors on a weekly basis that are either entering the space or considering entering the space or are startup. it's a very dynamic marketplace, both in terms of vendors that are entering the marketplace and in some cases vendors that are leaving the marketplace, primarily through acquisition at this point. Basically, it's the next big thing in health IT. Every vendor that we talk to says that they have some type of care management or care coordination solution. Their marketing is engaged around that. And it was something that was very prevalent when we were at HIMSS and going around to the various vendor booths in terms of the marketing jargon and nomenclature that we heard. Everybody's talking about this concept, even if they define it very loosely and very broadly in some cases. And in terms of the experimentation range we're talking about here, we mentioned a little bit earlier, it's really nothing's at scale with these initiatives. Organizations aren't managing 100 or 200,000 lives on these solutions. They're typically starting out with much, much smaller population numbers and types on them. We're talking maybe 5 to 10,000 patients for a Medicare Advantage population or a particular commercial population, or maybe their self-employed employees, their self-insured employees and their dependents, and before moving out to more broadly, wider population sets across various payers and payer types. In terms of the care management vendors that were in the report itself, there were really several different types that we profiled in the report and grouped them accordingly, each with their subsequent advantages and drawbacks. In the analytics vendors, these are vendors that provide data analysis for care gaps, risk stratification, etc. A couple listed on the right. A few of those are profiled in the report itself. The drawbacks here include immature care management tools. These vendors are either creating new care management tools from scratch or in some cases, taking existing care management tools and repivoting them towards the provider market and retooling them accordingly. There is PHM, called Personal Health Management, more of a catch-all category. The advantages of this market have robust analytics. They have care management beyond the direct clinical care team itself. And the drawbacks include scalability and maturity. These solutions are geared towards the physician office setting and enabling care within that particular setting and focusing on that. While they are looking to move beyond that, incorporate all clinical types and care settings today, moving ahead forward. The next major vendor type is your traditional EMR vendors. There's familiarity with them, ubiquity, ability to embed directly in the clinician's workflow in the outpatient setting. The drawbacks to them are architecture and interoperability. These solutions were really not designed, and we talked a little bit about that earlier, about that system of records, system engagement concept. These solutions were not designed from the ground up to necessarily enable provider-led care management as it's being defined today as we move to that more broader encompassing community-wide led care management concept. Talk to each of these vendors in the marketplace along with several other EMR vendors. The one point I would like to make here about, though, or like to define, is that each one of those vendors that's highlighted here has a very clear definitive strategy, though, around where their care management solutions are going or where they're at today and how they're moving ahead forward with that. There seems to be some confusion in the marketplace that EMR vendors don't have a strategy around this area. I would say very much that that's not the case, and if anything, that they have put some real clear investments and real clear thought behind this and are moving very aggressively in this area. There's some differences of opinions in the way that these vendors are tackling this and the strategies that they're using to employ. But if an EMR vendor does not, or an EHR vendor does not have a go-ahead forward strategy already in this area, I think that puts them at a significant disadvantage today. Next category is the clinician network manager or management vendors. These are really your traditional HIE or data aggregation vendors that are out there. The advantages that they have are around interoperability, the ability to create a longitudinal patient record among various data types, especially around clinical data. The drawback is they're just not directly embedded in clinical workflow, and getting clinician utilization and adoption of these solutions, especially physicians, has been very much a challenge. Some examples listed on the right. These vendors are often building a new care management application or module on their solutions themselves and adding that typically from scratch in most cases. In some cases that there has been an acquisition or taking some existing proprietary information IP that they had and using it within these solutions, but it's really primarily recreating and retooling solutions from scratch. Next category down is payer-oriented vendors, and the advantages that they have is the claims data. Historically, the drawbacks that they have had is that they have had a lack of provider client base and narrow market focus. These vendors are either building solutions from scratch. In the case of one vendor mentioned here, they have acquired vendors and they're looking to repivot those solutions to the provider-led marketplace, or they have essentially acquired a solution and they're looking to take other solutions that they had in-house and combine them together into a provider offering. I think the biggest challenge that these vendors face here is either just a lack of awareness in the provider-led marketplace or a challenge of getting provider clients onto these solutions themselves. The last two categories are patient relation management. These are primarily vendors that are focused on patient engagement and building additional utilization and functionality around this. And this is where we're seeing most of the primary startup activity focused on within this space today. Their challenge is really just a limited functionality. Again, they're starting out with a fairly specific defined use case and set of functionality around that, and they realize that in a lot of cases they're having to build much more quickly a broader set of use cases and functionalities for them to have broader traction place in the market today. And then lastly, what we're categorizing independent vendors. These are highly focused around clinicians' workflow and focusing on the task that a care management, nurse care manager has to focus on. Their drawbacks are integration into the broader IT platform. They face some of the issues that the C&M vendors face in terms of embedding these solutions and selling them directly into the clinician's workflow itself, especially around physician adoption in the marketplace. In terms of the top challenges for vendors today, we have really three categories here: short-term challenges, near-term challenges, and long-term challenges. The short-term challenges really are focusing around a lot of operational issues. How do you share interactive care plans, given that there's not a standard for that today, and the data exchange around a CCD document summary is not sufficient for that. Agreeing on care plan goals. What should be defined as a patient-defined care goal? How do you capture that in a structured manner? And then more importantly, recommend interventions that should be associated with that patient-defined care goals, very much an emerging concept area. Finding money for care management solutions. It's an additional IT application or solution that needs to be funded, and there needs to be an ongoing source to fund these solutions, given that they're being priced on a PMPM basis, that even though the unit cost typically goes down as more lives are added on the solution, the overall cost goes up if there's a significant number of lives moved over to these solutions. And then lastly, just varying data needs and data complexities. Not only are you dealing with various clinical data from various ambulatory EMR solutions and applications, but you're also dealing with increasingly claims data from various sources and other types of data. Primarily, health risk assessment data is being utilized either through the solution themselves or incorporating that from third-party data sources, or incorporating other types of data, primarily risk stratification, identification data, into these solutions today. And then also workflow, establishing an actual application, i.e. through a care plan that a nurse care manager can use for an individual patient, and getting claims data quickly. There's just been historical drag, and you've heard this come up time and time again about Medicare not being able to supply claims on a timely enough basis, and even getting claims beyond a 30-day run-out period has definitely been a challenge for most vendors from insurers today. In terms of the near-term challenges, this is more about a year and a half, 2 years out from the start of this year. It's moving beyond payers and incorporating additional stakeholders into this process, which is very much a work in progress and varies considerably from provider organization to provider organization, depending upon what initiatives that state or potentially city are trying to accomplish around local healthcare reform. Business plan development is very challenging in terms of the pricing models that are ongoing here. We, traditionally, or most of these vendors almost exclusively price on a PM model after some type of installation cost going forward with that. Where we're seeing some real changes here, though, and a move away from the traditional kind of health IT pricing, whether that was on a per bed basis in the hospital space or a per user basis in the ambulatory space. We're starting to see real at-risk types of guarantees here. Now, again, this is very nascent in the marketplace, and only a handful of vendors are doing this, but more providers are wanting their vendors to vary and bear some of the risks on this, or provide some level of assurances that their solutions will help them meet their goals. Very much an area of interest that we're monitoring moving ahead forward. And then lastly, risk stratification. Today, primarily these solutions incorporate risk stratification and identification data from a third-party data source, whether that's provided by a payer or provided by an analytics solution that they purchase. It's really embedding the risk stratification methodologies for various patient types within the solution today, and then recalculating that solution as new data becomes available. In terms of the longer-term challenges, there's really a couple here: regulation versus compensation. CMS just rolled out MACRA, and everybody's digesting that, along with several other recent programs that they have rolled out, CPC being among them. There has to be a real focus on what vendors are going to choose to focus on and how they're going to incorporate the necessary functionality to help their provider clients meet these federal demonstration programs and new payment methodologies that are being rolled out. We also have more care settings, primarily in the post-acute settings, and that incorporates skilled nursing facilities, that incorporates inpatient rehab facilities. Also really important around home health and how home health visits are being incorporated into this. And lastly, kind of integration with existing point solutions. As vendors, not only do they have a litany and a various array of EMR solutions that their providers typically are on among their employed physicians or among affiliated physicians, but they also have a number of other different data types or solutions that need to be brought into this workflow. A great example of this is referral management and bringing in referral management capabilities within these solutions today. Another example of this is the discharge planning process today. These solutions primarily today do not initiate orders and send orders. They primarily initiate that as a workflow item that needs to be scheduled and done. It's going to be a real interesting use case moving ahead forward to see what functionalities these solutions emerge to fit, and are they going to really enable a lot of the actual front-end processes around a couple of critical care processes within the care management spectrum. And then lastly, just the need to differentiate and scalability. Vendors are going to have to find either a particular way to differentiate themselves, a market to focus on, a little bit of fourth, and then scalability. Vendors are going to be asked to accomplish and meet a lot of different requirements as their providers need applications that will be able to meet a broad array of various payment reforms, not only to support traditional fee-for-service payment environments still, but also increasingly some of the value-based payment methods that are out there, both downside and upside risks that are being rolled out. In terms of the product capabilities, there were primarily three areas of criteria that we evaluated vendors on: data aggregation and content, care management workflow, coordination and engagement. Within data aggregation and content, there were primarily four categories: patient assignment management, the patient longitudinal record, which we've talked a little bit about previously. Still very much an emerging concept, though, in terms of what data is actually incorporated into these particular solutions themselves, and just how robust and how complete that longitudinal record is within these applications. Patient-generated health data, again, a broad array and litany of various data types that are being brought into these solutions, and then evidence-based content, some of the traditional data that you see, whether it is utilizing health risk assessment within the solutions themselves today, or starting to basically enable workflow applications in terms of providing interventions and tracking outcomes associated with that. Care management workflow, this really is primarily geared around the actual end users of the solution themselves. In terms of the care team administration, this really is focused on a nurse care supervisor who is typically monitoring several nurse care managers, basically tracking progress to see how those nurse care managers are doing, how patients are progressing through the care management program that the provider-led organization or the provider organization has put in place, and really enabling them to start to see some of the stopgaps and bottlenecks in terms of what's not working in the program and what is working on the program. Risk identification, stratification, again, we see a lot of this incorporated into or incorporated from third-party data sources today. We think that's going to change quite rapidly and quite quickly in terms of incorporating these methodologies directly within the solutions today, not only to separate and stratify patients, but more importantly, to stratify patients and activities that are assigned to an individual patient through their care plan. Care gaps. We did include this today in terms of a criteria that was critical to look for, and we do see these applications being used to address this capability, with several vendors focusing on that or keying on that today. As you see a lot of pay-for-performance and concepts that are out there in the marketplace. In terms of moving ahead forward, though, we've had some difficulty in terms of if this is going to be a care functionality that's addressed and recorded primarily within the EMR application, or these care management applications and solutions are going to address care gaps and record that and really be the system of record moving ahead forward. A lot of back and forth on that and not a lot of clarity right now in terms of addressing that capability. And then lastly, the care team work list. This is really the daily workflow list that a nurse care manager has to work through within these solutions in terms of the list of patients that are assigned to and the various task interventions that are queued up on a daily basis for that nurse care manager to work through. Lastly, just around coordination and engagement, we have care team messaging and notification, not only to the immediate care providers for providing care for this individual currently, but also potentially other available stakeholders that need to be added or deleted to this individual's care team as this individual is enrolled in a particular care program. Might be for a 30, 60-day, or 90-day time period after a hospital discharge program, or it might be an ongoing product, or it might be an ongoing enrollment and continuous enrollment for a patient who has complex medical needs, who's a polychronic patient. We also have patient and caregiver messaging and notification in terms of providing and not only giving information access to the care plan itself, which is still, as surprising as it may sound, not ubiquitously available among these solutions today, but more importantly, incorporating their caregivers. In a lot of cases, there is someone, especially if it's an elderly patient, who is providing care for this individual and helping this individual with their care, whether that is picking them up and taking them to the doctor's office, whether it is making sure that that patient is taking their meds accordingly and can understand what they need to do in terms of the instructions they receive from the physician, or several other capacities. It's also increasingly incorporating the caregivers themselves and providing them notification as to what's ongoing with a loved one or someone that they care about. Community-based referral management, and then also transition management. Transition management primarily today is geared around the discharge planning process in terms of the hospital to either SNF or the home environment, but we're also starting to see some additional transitionary events brought into this, i.e. someone who's at a skilled nursing facility or a long-term care facility that needs to be brought back to the ER and so forth, but it's primarily today focused on the hospital discharge process. In terms of the care management partnerships, this is one area we've been keeping close tabs on for a couple of different reasons. One, vendors are being asked to, from the previous criteria we asked, a laundry list essentially of requirements today. And there's not one vendor out there in the market that can meet all those capabilities today, and there won't be over the next year or two. It's basically a very extensive list and ask for what providers would want ideally out of these solutions, and the vendors themselves are basically moving as quickly as they can to try and meet them. And frankly, much more quickly than historically I've seen EMR vendors or their health IT application vendors move. You're starting to see quarterly release updates of significant updates versus the year, maybe biannual release update cycles that EMR vendors traditionally worked on in the ambulatory setting. I've been surprised we haven't seen as many partnerships formed in this area. It's really been limited to a few select areas. The main partnership area that we have seen so far is around risk identification, stratification. It's really embedding these various risk methodologies directly into the solutions themselves today. There are several vendors who've partnered in this marketplace. The primary vendors have been Johns Hopkins with the ACG, Risk Grouper, and then MCG are the leading vendors that are being utilized today. Although there are several other vendors that are being brought into this in this area, and we see a lack of clarity about really what dominant episode group or risk adjustment methodology clearly stands above some of the other vendor solutions. And then lastly, the areas of care management content and patient messaging notification are also in partnership areas too. Patient messaging and notification, because of the rampant startup activity we're seeing in that space, there were several vendors that we profiled with shorter profiles. In the report itself, we've had conversations with numerous other vendors that are focused in this space, and to be frank, they're moving much more quickly than most of the traditional or established vendors in this space, and we see likely that there will be some partnerships, if not right now, acquisitions in this area over the next, let's say, 12 to 18 months, as the more established vendors look for a means to not only provide access to the care plan, but more importantly, to drive patient engagement and really helping the patient not only understand what they have to do, but helping the patient input data to the care plan itself so that they understand what care goals have been assigned to them, if they can report back to that, and that there's a unified reporting structure that the nurse care manager can utilize within these applications. And then lastly, around care management content, this is an area today where most vendors are kind of cobbling together stuff from the public space or from vendors that they are using some content from. Very fascinating space for the most part. There's really not a lot of off-the-shelf content from the traditional vendors that are in this space and are focusing on this. We see this as an area where a lot of vendors are increasingly going to look to outsource this and choose a particular partner as the content matures a little bit more in this area around off-the-shelf care plan content. In the ambulatory setting and some of the additional care settings we've mentioned. A couple of vendors, though, have made some significant investments here and actually see this as a potential competitive differentiator moving ahead forward. It's going to be very interesting to see how that partnership works out and some of the dynamics as they unfold in this area. Current state of the marketplace, in terms of what we found from the study itself, there's really not a lot of separation right now in overall product functionality. In fact, what we found is most of the vendors are coupled pretty tightly, closely together. We expect that from a marketplace which really has a bunch of newer solutions into it, or a bunch of retooled solutions that are being sold into this space. We found there's a large degree of uncertainty, though, about what specific product functionalities will ultimately reside in these solutions and to what degree. We talked about care gaps and whether these solutions will be utilized as a system of record in terms of quality measurement moving ahead forward. I've heard very compelling arguments either for or against that. We talked about what data types are in the patient longitudinal record, what types of data is actually contained within these solutions themselves within that patient longitudinal record. And then lastly, we talked about the referral management and discharge planning processes. Will these solutions become workflow solutions and really start to initiate and send orders and receive orders as well? Or will they primarily just notate that additional items need to be done and other solutions will be utilized to adopt and utilized to actually enable the workflow themselves? Very much to be determined in terms of the scope of these solutions and what they'll focus on. Lastly, in the two areas we'll talk about here, limited patient access and overlooking caregivers. Patients and caregivers really need more than a simple level view-only access to their electronic care plan. We've all seen and heard some of the feedback about patient portals and some of the limitations that we've seen in the trouble that provider organizations have had, even the very low threshold requirements for stage 2 meaningful use. If these solutions really are going to enable, enhance, and drive much better patient compliance with some of the goals that are set out, interventions that are assigned to the patients as part of care plans, we really need much better solutions to address it. And frankly, I have seen some solutions that really offer some promise in this space, but it's been primarily among the startup or emerging vendor space that's out there. I think that this is going to be an area that is dominated by some vendors we've talked to and seen in this marketplace, with not only the changes that that they brought to the marketplace today, but they're quickly reiterating on and have very aggressive time frames moving ahead forward. And then lastly, the ability of these solutions to really address care transition events. We're seeing paper remain the de facto standard for transitioning patients from one care setting to another, whether this is the actual discharge planning document itself, i.e. sent by fax or sent with a paper copy and a handoff as that patient is either sent home or sent to a skilled nursing facility. These solutions themselves today really, in terms of the discharge planning process, have limited capabilities, and it's going to be very interesting to see to what state they are incorporating additional functionalities and methodologies that address care transition events. Vendors state that they incorporate several different methodologies that are used for discharge planning today within their solutions, but when we really get down to it, it's fairly limited in terms of what the aspects of those methodologies are incorporated into the actual solutions themselves today, with a couple of exceptions. Conclusions, I just want to wrap up here and talk about some of the things we're really focused on looking at and evaluating moving ahead forward, both over this year and also when we start the update for this in the latter half of the year, starting in Q3 and really in Q4. These are some of the things that we're really focusing on looking at around care management solutions that we think are going to be critical in the marketplace as some of the vendors start to separate themselves out and you start to see some more vendors really emerge as potential market leaders. The first one's around automation. We're focusing really around which solutions will have a higher degree of automation from everything from assessments, interventions, to referrals. These solutions today are highly manually driven. They require a large degree of data input from the users themselves. They require a heavy degree of utilization from the end user in terms of a whole wide array of functionality that we previously discussed. And to be frank, these solutions, if they're going to scale to anywhere near the number of patients that will need to be enrolled on, we're going to really have to increase several levels of automation to them. These resources that are utilizing these solutions are too expensive and too limited, especially around the nurse care managers who start at a high five-figure dollar value, if not even low six, depending upon the geographic value you're in annually to be utilizing these solutions. You're really going to have to basically become much more efficient with these limited resources and expensive resources. Engagement. We're really seeing here in terms of vendors, stop paying lip service about, we're focused on the patient, we're focused on the caregivers, which is still somewhat kind of a secondary afterthought, and really making them equal partners in the care management workflow. If you want a patient to care about their health and really try and drive improvement, they have to have a couple of things. One, they have to understand what they should be doing. It seems somewhat rudimentary and somewhat basic, but there's a lot of confusion, a lot of difficulty around that, especially around a complex patient who has a lot of medical issues and has a lot of things, medications that they're taking, things that they should be eating in terms of dietary restrictions, a lot of complications around that. They really need to be made aware of that. There might be a language barrier that comes into play here. Several different aspects that come into the patient relationship. But also more importantly, I think the caregivers themselves. I deal with this issue on a personal basis with my mother in terms of struggling to coordinate care that she needs for a medical condition that she has. And it certainly is frustrating that I really have to spend a lot of time and energy to coordinate that and use a lot of manual processes, phone calls, text messaging, in some cases even scanning documents and sending them to really kind of coordinate that care. I'm really looking to see how vendors are going to look to improve that process and what solutions they're going to do to enable that. Efficiency. We talked a little bit about this with the automation point I mentioned earlier. They kind of go hand in glove. It's really which solutions will let HCOs manage 100 or 200,000 lives, maybe even more, without significantly corresponding sizable investments in personnel. Organizations aren't going to be able to go out and hire a small army of nurse care managers. Their analysts that they can hire are additionally limited, let alone other critical care inputs here in terms of physicians. These solutions are going to have to really enable the limited numbers of FTEs that providers have to address these solutions effectively and optimally. In terms of the service point, it's really which vendors will prove their solutions provide an ROI. and let HCOs leverage these HIT resources most optimally. We've seen a couple of vendors take some unique approaches to this, and there's always a lot of complications in terms of what should be included in a numerator and a denominator for these calculations, or what time span they should be done, and how you set them up beyond a basic pre and post comparison in terms of implementation of the solutions themselves, the lack of a valid control group, classic kind of health service methodologies, limitations, and questions when evaluating them. But I think increasingly vendors really are going to be scrutinized on this question, and really are going to have to provide something of substance beyond just a very nebulous case study or example of a particular client. And they're going to really have to start to quantify this a bit more succinctly for not only their overall package of solutions, but on a module by modular basis. And then lastly, support. In terms of as HCOs, face a broad litany of not only federal requirements and federal demonstration programs that are being rolled out to them, but they also have to increasingly deal with state and local requirements. There is a very large degree of complexity right now with state Medicaid programs, even within states that have not chosen to adopt Obamacare and expand Medicaid enrollment, are moving quite aggressively to some form of Medicaid managed care. And these programs are increasingly looking to incorporate providers into provider-led care management demonstration programs. And then lastly, just the commercial payers themselves. All of the large national commercial payers have made a large commitment to move to value-based payment almost as aggressively, if not even more aggressively, than the time frame that CMS has rolled out. And providers are going to have to meet these initiatives. So really, how are vendors going to help their providers meet these broad litany of requirements themselves, but also build the functionalities across these various types? I think that a lot of providers are really going to struggle with this, especially around some of the state and local demonstration programs that are rolling out that have some differences between some of the federal programs that have rolled out to date. I just wanted to thank everyone for attending. Now we will begin the Q&A.
Okay, thank you, Matt. As he said, we'd like to open it up to the audience for questions. As a reminder, please use the questions section in the GoToWebinars panel to submit your questions. The first question, will you be evaluating the devices like phones, tablets, most suitable from both connectivity and security perspectives?
In terms of the security issues, that's not something necessarily focusing on, but in terms of these solutions providing both a tablet-enabled and a mobile application view, absolutely. It's something that we are tracking, something that vendors either have developed that today or are focusing on developing around particular applications, and it is going to be critical because the number of use cases that are going to be made available on a tablet or on a smartphone are something that's critical. And are vendors creating applications and solutions to meet those? The answer is yes. Are we tracking that? Yes. And it's something we can provide additional follow-up on offline.
Thank you. Who is most often driving the purchase decision for care management solutions at acute care facilities?
We talked a little bit about this earlier on when I brought the point up about who the buyers were and how organizations are structuring to make these decisions. I typically say it's an organization that has a board structure from several different stakeholders. There's usually someone, chief medical officer, someone from the physician side of things who is represented here, maybe the leading stakeholder. But we also see several other different types of stakeholders. We typically see a chief nursing officer or someone from the nursing department who's a senior individual. We typically see someone from the post-acute organization who is represented at these organizations, either as senior vice president, or even director level. And then several other different stakeholders emerge, including IT or someone from the information department. What we have seen, though, is that I'd say that the purchasing power is primarily being directed from the chief medical officer function, or a chief nursing officer function increasingly, because they primarily are the direct users of these solutions today, whether that's a nurse care coordinator in terms of discharge planning, whether that is a nurse care manager who, again, is practicing in the outpatient setting. those have been the stakeholders that we have seen. I guess the challenge is that it varies considerably from organization to organization in terms of not only what the board composition or structure is, but also what the vehicle for doing this. We've seen a lot of organizations, if they have a legacy PHO organization, utilize that as the contracting vehicle and structure, and basically enable that organization to make these decisions. If it's a hospital-led ACO that's created a new board structure for that particular hospital-led ACO, that organization typically has purchasing power. It varies considerably from organization to organization. I think it's been hard to make broader defining conclusions, except that it has shifted away a little bit from the traditional CIO purchasing role for solutions made on the inpatient side.
Okay, the next question, can you talk a little bit about where interactive personal health record comes into the picture for care management?
I think the interactive care personal health record really fits within the confines of the care plan itself. We had done some research on this last year around a report I published on the current state of care plans outside of the hospital environment, and really gets into this issue of patient-defined health goals in terms of what's discussed with the patient, what they agree to, and then being able to quantify that in a pretty succinct manner in terms of a particular goal that's agreed to by both the clinician, usually the nurse care manager, potentially a physician, and the patient themselves, and then what interventions or tasks are associated with that. Some of those will be assigned to the providers themselves, but often, in a lot of cases, a number of those are assigned to the patient directly and or their caregiver stakeholders. That is where the concept of a personal health record fits within the confines right now of a care management solution from what we've seen. The key there then too is also enabling that across a couple of different modalities, whether that is through a computer, whether that's through a smartphone, whether that's through other methodologies, so that the patient not only can access that as necessary, but has a very clear understanding of essentially what the nurse care manager is expecting that patient to do, and if they can't do that, why they can't do it, or why they're having difficulties accomplishing that in terms of moving ahead forward, what are some of the issues there, and then bringing other members of the care team on board to basically alert them of what issues and difficulties that patient is facing when trying to complete some of those interventions that have been assigned to them. That's where we see the personal health record itself fitting in with the concept of these care management solutions today.
Great. Are there specific patient populations that vendors or health systems are focused on?
I'd say that the two populations we've seen the most that they start with is they're self-insured, which most larger IDNs tend to be. Once you get above, let's say, 5,000 to 10,000 employees and or independents, they typically self-insure. That's a population they're often starting on with these solutions. And then we've also seen a number of organizations start around their Medicare Advantage population. Those are two populations. Commercial also, there's a large degree of interest in doing this depending upon what type of arrangements they have with various commercial payers that are out there in their marketplace. But I'd say primarily it's around their self-insured employees and dependents, one, and then Medicare Advantage would be 2A and commercial would be 2B.
Okay. Are there a handful of vendors that you would consider care management solution thought leaders?
At this standpoint, I'd have to say no. There's still a lot of ambiguity in the marketplace in terms of providing thought leadership. We see this, some vendors though are providing, have made some investments, whether that's around creating and curating care management content, around providing additional services. I think where they're going to look to provide, i.e. thought leadership around is some of the services increasingly that we see these vendors providing. I think that that's going to be a critical area moving ahead forward. These are not solutions that can be through the typical installation process installed, using a trainer approach, and then basically you check in with that organization or basically provide them with standard levels of support that we've seen offered in other health IT applications, primarily in the EMR space or the HR space. I think that vendors increasingly are going to have to provide a broader arrangement and litany of services to basically wrap around these solutions to help their provider organization. And the vendors are certainly interested in providing those, besides the obvious additional revenue and upside potential, but also really to enable optimization of their solution to help organizations really meet and drive towards the goals that they're outlining for their various care management strategies.
All right, the next question, will the trend be to choose EMR vendors so all data stays within one system versus a platform that sits outside the EMR with some bidirectional feeds? What are the pros and the cons?
I think that you're going to see two different types emerge, two different types of provider organizations emerge here. One, you're going to see provider organizations that have already made substantial investments in with certain vendors, primarily Cerner and Epic, not only within the inpatient setting, but also within their outpatient or employed physicians and some level potentially of affiliated physicians, though that's not quite often the case. And then they've also adopted potentially a patient portal application or solution along with other applications. Epic, for example, just recently released an updated version of their care management software. Those vendors those provider organizations that have chosen to go that route, I think will most likely see what those two vendors can do. Each of those vendors has their respective strategies in this area. We had a real detailed look at both of them, and we rated and evaluated each of those vendors with their respective strengths and weaknesses accordingly as the way we saw fit. Ambulatory vendors, ambulatory EHR vendors also fit into this bucket too. Some of the vendors, I think, have a strategy that really focuses a bit more on monetizing and enabling workflow through their existing solution suite, whereas other vendors don't frankly and readily acknowledge that they don't have the broad capabilities and workflow sets to enable this functionality today, and also there's going to be other applications that need to be brought into this. I think what you're going to see is that providers that have made large levels of Epic and Cerner are going to tend to look towards those vendors first. So there's going to be a large number of other vendors that either have a broad litany of various IT applications across their organization, or are price constrained, or have other factors that are going to look for other vendors in the space. I think that you'll see the care management vendor solution not necessarily be the system of record, and in terms of dumping large amounts of patient longitudinal record data and as being the defining source for that, but I definitely think that data will be available there, especially the updated or timely data. So I think that these solutions are going to emerge, and you're going to see solutions built off of or layered on top of EMR solutions in a lot of cases in terms of moving ahead for that. The question is really, what is the patient longitudinal record, and what data sources are going to be put into these solutions is very much to be determined at this point.
How will the current messy landscape of vendors feed population health management? Are there any vendors for PHM?
Again, we talked a little bit about this previously. We had one of the vendors defined as PHM. We have our own definitions and solution suites as we've had these conversations with vendors and providers and their stakeholders in this. In terms of the care management applications we talked about today, that's basically one major aspect of these solutions today. Another major aspect of that is the analytics and reporting capabilities and analysis and analytic capabilities that these solutions include. We had issued a separate report also that came out earlier this year that looked at some of the capabilities and vendors that were in that marketplace. And then there's really two other broader buckets. One is really this kind of patient engagement or patient relationship management. We talked about some of the vendors that are in this marketplace that are creating care management modules, but there's vendors also we did necessarily profile or focus in this study who are going after that market pretty aggressively with some various formats or flavors. And then lastly, just around the question from information exchange, basically being able to not only intake data in these solutions, but being able to send it out both on the data side but on the order side. So the care management applications we define today is more kind of four stools as we're seeing the marketplace emerge, and we try to focus in this report in particular on the care management only functionalities and activities that were relevant to the marketplace today within the confines of this report, and then with some of those other reports and areas we cover, focus on those a little bit more in depth in those other reports.
All right, that was our last question, so this concludes the webinar. Thank you for joining us today, and thank you, Matt, for an interesting and informative presentation. We look forward to seeing you at our next HIS Talk webinar. Enjoy the rest of your day.